Hello guys, welcome to Basic Classes of Nursing. Myself Amanpreet. Today we are moving on with maternity nursing and we are going to discuss about the complications of labor and delivery. So let's move on. In complications, we are going to discuss first the first stage of delivery. We all know that in first stage there occurs the dilation of the cervix. So, in dilation phase, you have to continuously monitor the fetal heart rate. So, to monitor fetal heart rate, we should know the normal rate. So, normal fetal heart rate is 110 to 160. Okay, so when should a nurse be alert about fetal heart rate? So the conditions are, firstly, if it is low fetal heart rate, like it's less than 110 per minute, then it is bad, it's not good, it's a complication. And second is late deceleration. Now what's a late deceleration? It means that the heart rate of the baby, it slows down near the end or after a contraction. Okay, that's also not good. The third thing is variable deceleration. Now, variable deceleration is also not good. It means that there is cord prolapse. That you can also say prolapsed cord. And the fourth one is low baseline variability. Now, what is low baseline variability? Low baseline variability is that then when the fetal heart rate, it stays same and doesn't change with the contraction. There is no change. Okay, so for all these things, all these four things, low fetal heart rate, late deceleration, variable deceleration and low baseline variability, you will do four things. The first thing is turn the patient to left side. Okay, then is oxygen. Third one is IV fluids. And fourth one is notify. Okay. And apart from these four things, there can be some other things, like there can be high fetal heart rate if it is above 160 per minute, or there is early deceleration. That means that the baby's heart rate that slows before or at the beginning of contraction. And third is high baseline variability. That which means when a fetal heart rate is changing, it's not stable, it's changing with time, with every contraction. So that means that it's good. So you don't have to worry about that. Just document it and you are fine. Okay, so these are complications which can be related to the first stage. And in second stage, there is the birth of baby, you all know. And during the birth of baby, you have to suction the nose, and if necessary, you have to suction the mouth also. Okay, and let's move on to third stage. And in third stage, you all know that there is birth of placenta. And for placenta, you always have to check that there are 3 vessels in the cord. And in 3 vessels, there are 2 arteries and 1 vein. And if there is something wrong, you have to notify. Okay, and in the fourth stage, there are 4 things which are important. So the very first thing is vital signs of the mother. Okay, the mother can go in shock, she can be pale, her skin can be cold and clammy. You have to check that. Then second is fundus. We have earlier talked about the fundus. that if is whether it's firm or not. Okay, then after fundus there is, you have to check for the saturation of pads, the bleeding status. Okay, you have to check that if the mother is bleeding very high, there's high bleeding, so you will check the saturation of pads every 15 minutes. And if a mother is saturating the pad 100% every 15%, that means that there is excessive bleeding. Okay, and you have to check for the bleeding status underneath her, like you have to roll her over and check for the bleeding underneath her. It's very important to note down this. So these are some complications during the stages of delivery. Okay, good luck for your exam.